Bonjour, bonjour. Bonjour tout le monde. So we'll hear from la ministre Michel, ministre fédérale de la Santé, and we'll also hear from the Honorable Adriana LaGrange, Alberta Minister of Primary Care and Preventive Health Services. We're also joined by some people online, some minister online. Après les discours, on va prendre quelques questions des médias. After the remarks, we'll take some questions from media. And we'll start with Minister Michel, I believe.
Bonjour à tous. Je suis ravie d'être ici à Calgary en compagnie de ma collègue coprésidente Adriana LaGrange pour conclure ces quelques journées fructueuses. La réunion d'aujourd'hui s'inscrivait dans le cadre d'une collaboration renouvelée entre le gouvernement fédéral, les provinces et les territoires. Cette collaboration renouvelée s'inspire de notre engagement commun à protéger notre système de santé et à obtenir de meilleurs résultats pour les Canadiens. Nous voulons tous la même chose, un système de santé qui fonctionne pour tous les Canadiens, peu importe qui ils sont et où ils vivent. Today's discussions have helped set the stage for further cooperation as we work towards that goal. We addressed the challenges created by the current context south of the border, but also the opportunities that come with it. We can build Canada's domestic biomanufacturing capacity to produce state-of-the-art vaccines, accelerate access to new medicines, prepare for future health emergencies, and support Canadian research and jobs. Just last month, I was in Laval, Quebec, to celebrate the first domestically produced COVID-19 vaccine by Moderna. But we need more of that. We must make Canada more attractive and competitive for investment in new medicines and digital health innovations. This is why we are modernizing regulations, cutting unnecessary red tape, improving transparency, and speeding up drugs approval. We are also working closely with CFIA and PMRA to reduce the administrative burden on farmers. Vous savez, il y a une question qui est revenue dans toutes mes conversations cet été à travers le pays, celle de la santé mentale. La santé mentale exerce une pression énorme sur notre système de santé. Nous sommes confrontés à une crise de santé mentale et de toxicomanie ici au Canada. Il n'y a pas de solution miracle, mais ensemble, nous pouvons améliorer les choses. Et je crois que nous assistons à une collaboration exceptionnelle entre tous les ordres de gouvernement. One example of that is the expansion of integrated youth services. Just yesterday, we announced a new agreement for integrated youth services here in Alberta. There are now more than 110 hubs in 9 provinces, with 50 under development. Since the 988 Suicide Crisis Helpline launched almost 2 years ago, responders from across Canada answered more than 600,000 calls and texts. Working in partnership, we have an opportunity to keep learning, growing, and enhancing the support that help Canadians find hope. We were also joined today by Canada's fentanyl czar, Kevin Brousseau, who shared an update on the fight against the illegal fentanyl trade. I thank him for his work and the work of all law enforcement agencies in keeping illegal drugs out of our streets. Une autre question qui nécessite un effort collectif de la part d'Équipe Canada est la reconnaissance des titres de compétences. Soyons réalistes. Trop souvent, les médecins de ces pays n'ont pas le temps d'offrir à leurs patients tous les soins qu'ils aimeraient leur prodiguer. Si l'offre de professionnels augmente, la demande augmente encore plus rapidement. Nous pourrions remédier à cette situation en veillant à ce que les milliers de professionnels de la santé formés à l'étranger qui se trouvent déjà au Canada travaillent effectivement dans le domaine de la santé. Oh my God. Sorry. Des forums comme celui d'aujourd'hui nous permettent de partager les meilleures pratiques et de discuter de la manière de résoudre enfin ce problème. And we are seeing good results across the country. The federal government is currently signing agreements with colleges for internationally educated health professionals projects. Alberta has been seeing many new foreign-trained doctors joining their workforce. BC is now streamlining doctors and nurses from the US. Ontario has a similar program. Manitoba is also doing great with nurses. I could give many other examples of what we can do when we come together. Today, we also came together as health ministers to endorse the need for a federated model for licensure for physicians. We all recognize that improved labor mobility can help address physician labor shortage. I want to acknowledge the work of the Federation of Medical Regulatory Authorities of Canada in their work to advance such a model. Almost as important as the people who power our health system are the tools and innovations that help them deliver care efficiently. Even if 95% of physicians now use electronic medical records, those records are often not connected to each other or the rest of the system. This creates barriers and unnecessary burden, especially in rural, remote, and indigenous communities. And quite often, it leads up to a pile of paper accumulating in many of our offices. Today, we discuss the importance of continued collaboration in modernizing healthcare with health data and digital tools. Data saves lives. By leveraging AI, we can make technology work for people, improving lives, improving care, and building a health system ready for the future. I look forward to passing legislation to improve connectivity and data sharing across the country. This is the interoperability bill. We also reiterate the importance of vaccination in preventing illness and saving lives. My colleague and I are committed to work together on immunization programs to curb the spread of measles and other viruses in our communities. La force du Canada réside dans sa population, et notre santé est la pierre angulaire de notre réussite. En cette période d'incertitude, marquée par l'instabilité mondiale, les pressions économiques et l'évolution des relations internationales, nous devons investir en nous-mêmes. La santé est un investissement. Lorsque les Canadiens sont en bonne santé, ils peuvent prendre soin d'eux-mêmes, de leur famille, contribuer à leur communauté et maintenir la vigueur de notre économie. By improving our healthcare system from coast to coast to coast, from the north to the south, we are helping building Canada strong. By working together, we are investing in Canada's future, our long-term success, and our collective strength. I look forward to continued partnership with my provincial and territorial colleagues as we strengthen our shared system. Thank you.
Thank you, Minister LaGrange.
Thank you, Minister Michel, and good afternoon to everyone. Today, we welcome Minister Michel and discussed how the federal government can work with provinces and territories to address the most pressing priorities facing Canada's health systems. With equitable and sustainable investment from the federal government, we can sustain, improve, and transform our healthcare systems to meet the needs of patients right across the country. We spoke about the Canada Health Transfer, the federal contribution to provincial and territorial health budgets, which represents approximately 20% of total health spending per province or territory. The Canada Health Transfer is not keeping pace with the rising cost of delivering care. At our meeting yesterday, we discussed a nationwide call to enhance the Canada Health Transfer and maintain the 5% annual escalator. This is one of the most effective ways for the federal government to help provinces and territories meet growing healthcare demands, because it provides the flexibility needed to respond to the distinct needs of each population. With the new federal budget yet to be tabled, we join our finance colleagues in urging the federal government to strengthen the Canada Health Transfer and provide long-term, predictable funding. And we appreciate Minister Michel's commitment to meet with all of the health provincial territorial ministers following the November 4th budget date to share the impact to our provinces and territories of the budget that will be tabled. Our health systems and the patients and healthcare workers who depend on them are under tremendous strain. Yet, across Canada, there is also incredible innovation, collaboration, and commitment to build stronger and more resilient systems of care. We also discussed federal bilateral agreements, including those arising from the 2023 funding framework, and the need for clarity on current, developing, and soon-to-expire federal commitments. For example, the Aging with Dignity agreements that will expire soon. We asked for a positive and flexible change to the approach to these agreements. A one-size-fits-all model does not serve the unique needs of the residents in each jurisdiction. In some cases, federal programs duplicate services that are already in place, adding administrative complexity without improving care for patients. Provinces and territories are calling for a more consistent and collaborative approach to ensure equitable access to care across the country. And we heard very loudly and clearly from Minister Michel that she wants that collaborative approach. So thank you, Minister Michel. We also raised the importance of ongoing collaboration on Indigenous health. All governments, federal, provincial, territorial, and Indigenous, must work together to ensure stable funding and programs that reflect the priorities and the perspectives of Indigenous communities. We are encouraged by the federal government's support for our collective efforts to reduce barriers for foreign-trained health professionals. However, further reform of national immigration processes is needed so that these skilled professionals and individuals can arrive sooner and begin delivering the care Canadians need. Finally, we discussed the impact of global factors, including U.S. tariffs, on the cost and supply of pharmaceuticals, medical supplies, and equipment. These challenges remind us that healthcare systems must be strong, adaptable, and ready to serve Canadians no matter what pressures arise. These are just a few of the issues that demand timely, coordinated action. Provinces and territories are ready to continue working closely with Minister Michel and her officials to make meaningful progress on these shared priorities. In these uncertain times, there has never been a more urgent need to support and strengthen our healthcare systems so that everyone in Canada can count on access to high-quality, patient-centered care close to home when and where they need it. Thank you all for being here, and I can just say we had just incredible meetings over the last 2 days. Thank you.
Merci beaucoup, Madame la Ministre. On va maintenant prendre les questions dans la salle avant de se tourner sur Zoom. Il y a un micro à droite de la salle. Donc, les questions sont pour tous les ministres qui sont sur la scène. Évidemment, je vous demande de garder une question avec une question de suivi. Indiquez votre nom, votre média, à qui votre question s'adresse. We'll take questions in the room before moving online. All the ministers present here today are able to answer a question. Please state your name, your media outlet, and whom your question is directed to. And please keep it to one question, one follow-up. Thank you.
Hi, thank you. Laurence Tachot, Radio-Canada. My first question is for Minister LaGrange. regarding the Wyant report today. So given the investigation limitation recognized by Honorable Wyant himself, are you prepared to support a call for broader public inquiry endowed with the power to compel sworn testimonies?
Well, as I've been here over the last couple of days hosting my colleagues, and I have to say they're incredible colleagues, I have not read the report yet. I did get a high-level briefing on the report. My understanding is that he looked at well over 2.5 million documents over the course of his investigation. He interviewed, I believe, somewhere over 25 people. He made 18 recommendations, and at no point did he find any issue with anything that was done by a minister or a minister's staff. There was nothing that he found, whether it was at the public service level or at the government level. He did raise concerns around Alberta Health Services and their procurement process, which is something I've been saying for a very long time, actually probably since the day I became the Minister of Health, that I had questions around their procurement process. And so my understanding is those 18 recommendations are very good recommendations, and we will be looking to enact every single one of them.
Okay. My follow-up would be, so those limits were regarding the fact that some people could refuse to be interviewed or answer questions. So do you believe that it would be maybe adding to the credibility of a further report if there were sworn testimonies or more power?
My understanding was that everyone that was asked to be interviewed, except for one, was interviewed. I was never asked to be interviewed. I would have gladly agreed to be interviewed had I been asked. But again, I do believe looking at over 2.5 million documents, et cetera, all the things that I said earlier, really indicates that he was very thorough in his investigation.
Thank you.
Thank you.
Hi, Minister LaGrange. It's Ezra Levant from Rebel News. My question is about nicotine pouches like Zyn that are used by smokers to quit cigarettes. But Justin Trudeau and now Mark Carney have effectively banned these products in Canada. You have to get them from a pharmacy. You can only get one at a time. It's much stricter than the cigarettes themselves or even marijuana. Would you consider asserting provincial jurisdiction and respecting the Alberta value of freedom and bring in a made in Alberta regulatory scheme for nicotine pouches rather than the made in Ottawa scheme?
Well, great question. I would say that the rationale behind the current process, which is having nicotine pouches within pharmacies, is really to protect our youth. And so while the intention is really good and honorable, I do think that adults probably would like to have more access to those pouches to curb their smoking habits. And so I would always look at policy. I do think this was federally introduced. I would love to have the conversation with my federal colleague on this, but look at what the options are for Alberta. Because I have heard from adults that find it onerous to go and get a prescription, as you say, when there is freer access to other products that are as harmful or perhaps even more harmful. But our main goal always has been in Alberta, how do we protect our young people? And we are seeing rising issues around not just nicotine pouches, but vaping. Those are huge concerns for all of us. So thank you. We'll look at it. We're always open to looking at policy and looking at what makes sense.
Thank you, Minister.
Thank
If
you.
I may be permitted to use my follow-up for Minister Michel. And first of all, thank you, Minister, for agreeing to accredit Rebel News. I very much appreciate your dedication to freedom of the press. I have a question about the ostrich farm. Now, don't worry, I'm not going to ask about the lawsuit because I don't want you to talk about anything that are before the courts. But there was a letter, and I noticed in the statement you talk about Canada-U.S. cooperation. I know that Robert F. Kennedy Jr., your U.S. counterpart, has written saying he thinks that there's some medical research value in these ostriches because they had avian flu, but then have recovered and are now immune. In fact, he's offered to do the research and even to pay for it. It seems to me that we need allies around Trump's cabinet table. And if you could throw him a bone and say, sure, Secretary Kennedy, you can study these birds. It's sort of no skin off Canada's nose, and don't you think it would be helpful to have an ally in Trump's cabinet when we're doing our trade negotiations?
Prochaine question, merci.
That's my question. Don't you think it would be helpful to
Thank
have a
you.
friend?
Next reporter, merci.
Oh, you're not going to answer, Minister?
Prochaine question, merci.
I don't understand. Did I do something wrong?
Next question, thank you.
Minister, did I miss an answer? I don't get it. Okay, I'll sit down. I guess it's question period, not answer period.
Merci beaucoup.
Stephanie Thomas, CTV Calgary. This question is for Minister LaGrange. I'm just taking a look at the communique, the public health priorities, recognizing that vaccines save lives, and ministers will discuss coordinated actions at a future meeting. And I guess I just wanted to ask, with those discussions, was it at all awkward with your provincial and territorial ministers, knowing that Alberta's approach to the fall immunization program, especially when it comes to the COVID vaccines, are markedly different?
Well, we all struggle from the same financial issues across the country. And I would say that conversations, and we really put this to the next meeting because we want to have a more fulsome discussion. We know vaccine hesitancy is real. We know that there is an opportunity to look at how do we work together to reinforce a strong public health system right across the country, across the territories and provinces. So that is the reason we put it to the next meeting. We want to have a really fulsome conversation on it. But we know that not just COVID vaccines, we're into influenza season, RSV. We know that we all have those challenges. And so how do we work together to make it more appropriate for all of our citizens to get the information, that it's good, reliable information that they can count on. And so those are the discussions we're going to be having. I'm not sure if any of my counterparts would like to. Minister Azaguera. Minister Azaguera was very instrumental in the conversation when we had it yesterday, so go ahead.
Thank you, Minister LaGrange, and I want to thank you again for being such a wonderful host. You've hosted us all very, very well. The conversation around vaccines is obviously a national conversation, and being around the health minister's table has been great to talk about ways that we can strengthen our approaches in our respective jurisdictions. Manitoba is a strong proponent of strengthening public health care and making sure that people have the information and the tools they need to make the most informed decisions to keep themselves, their loved ones, and communities safe and protected. So we all collectively understand the importance of this conversation. We look forward to engaging from provinces and territories with our federal government on this and how we can do more in public health to make sure we're protecting as many Canadians as possible.
My follow-up, I'll also direct back with you, Minister. This has to do with the Wyant report as well. I know my colleague in the media also just asked it of you, but I think it's worth me addressing again that it did not find any conclusive evidence of wrongdoing, but that was because the report author himself said that there wasn't clear evidence. And you didn't participate. You say you weren't asked and you weren't compelled to testify under oath, but the provincial government appears to claim that there's an exoneration of any wrongdoing in the procurement process. So can you respond to that?
Again, I have not read the report, but my understanding with the briefing that I have received is that over 2 million documents were looked at. 2.5, I believe, is the number. I believe it was 25 people or more were interviewed. The recommendations that have come forward have highlighted that there were procurement issues within Alberta Health Services. I've been very clear that has always been a concern of mine from the beginning, pretty well the beginning when I started as Minister of Health in 2023. And I believe that he has done a thorough investigation. That being said, we will continue to look at the report. I know that there's other investigations ongoing, and we will look to see what comes of those reports. But again, there has been no wrongdoing from what he could see or find in all of that documentation and all of the report and all the months that he has investigated of anything amiss by a minister, a minister's staff, or anyone in the public service. And I believe that is important to note. Thank you.
Hello, Leah Musher from the Western Standard. My question is actually for Minister Michel, so yeah, thank you. It's regarding the nicotine therapy products, replacement therapy products once again. I know in 2018 your government issued a statement on how by 2035 you want to reduce smoking to like lower than 5%. So would you ever reconsider the regulations around these products?
No.
No? Is there a reason?
No, I think we made the decision and we are moving with the decision we made at that time.
Okay. Okay, thank you.
Okay, I think we're going to move to the questions on Zoom. Mark, over to you. Thank you.
Thank you. If you are a reporter on the Zoom and wish to ask a question, please use the hand-raising function. Encore une fois, vous aurez le droit à une question et un suivi. Merci d'indiquer à qui vous aimeriez poser votre question. Our first question comes from Lauren Pelly with CBC News. Lauren, please go ahead.
Hi there. Minister LaGrange maybe wants to speak to this one. Let's start with that. Provinces like Alberta and Ontario as well are signing contracts with for-profit operators. Some of this has been released through access to information requests, showing taxpayers are being charged double, even triple for the same procedures done in hospitals using the same healthcare workers. What is the criteria ministers are using to evaluate these contracts?
I think what you're talking about are chartered surgical facilities, which in fact have existed for a very long time in Alberta, and I dare say in other provinces as well. And I just would remind all the viewers that anytime you go to your family physician, that is a public-private partnership. Those doctors oftentimes run their own clinics. They are their own businessmen. And so that is an ongoing public-private partnership. The chartered surgical facilities are private-public partnerships where you go, you get a surgery done, but it is fully paid for. And so that is another way to expand the number of surgeries across the province and across the country. When we are in a deficit situation where we have so many people that are waiting out of clinically appropriate times for their surgeries, we have to make sure that we utilize every avenue. Now, the chartered surgical facilities in Alberta, those contracts were negotiated by Alberta Health Services previously, and as we stand up the new format in Alberta with the 4 pillars under Acute Care Alberta and Recovery Alberta, Primary and Preventative Health, as well as Assisted Living Alberta, we are going to have a procurement and optimization secretariat that actually will be negotiating. We've already committed to patient-focused funding to determine what the amount should be for those surgeries, and we will have it consistent across the province. We're going to enact all of the recommendations. Some of those recommendations, I believe, also are contained in Judge Wyant's report. So I think there's lots of room to look at improvement, but right now there's a huge need. Right now in Alberta, roughly about 65% of surgeries are being done in clinically approved time frames, and that is up from about 40% just a few years ago. We need to get to a point, and I know all my colleagues would agree with me, that we see 100% of surgeries being done in clinically approved times. That is what Albertans, that is what Canadians deserve.
Just a follow-up question as well, Minister, or any other ministers who want to weigh in on this as well. What accountability is there for taxpayers when for-profit operator contracts are not being made public?
We are looking to introduce into Alberta a very transparent process where people will know what the actual costs of a surgery, albeit whether it is a knee surgery, a hip surgery, cataract surgery. Very soon we will get to a place in Alberta where that transparency will be very apparent, because that's what we have committed to. But contracts that have been negotiated, obviously there are rules around contracts, and so what has happened in the past is not what is intended to happen in the future, but again, we are living with some legacy pieces, but we have committed to making sure that there's transparent, at least so people have an understanding what the overall cost is. Most people recognize that that if you travel out of province or out of country, you're paying exorbitant costs to have a surgery done. So we want to see surgeries done in our province, done at a reasonable rate, at an appropriate rate, and that we get as many done in 100% clinically approved timeframes. Is there anyone else who would like to join in the conversation? No? Okay. All right.
Thank you. Our next question is from Reza Patel of the Toronto Star. Please go ahead.
My question is for Minister Michel. I'm wondering, have you started conversations on reaching pharmacare agreements with any of the 9 remaining provinces and territories that do not yet have deals?
I am committed to have ongoing conversation with all my counterparts, and we already did yesterday and today.
And as a follow-up, has any progress been made, or are you any closer to reaching a pharmacare agreement with any of those outstanding provinces or territories?
I'm going to repeat, we have conversation, and I committed to continuing conversation with them, each of them, and to consider their needs.
Merci beaucoup. Next question is from Tessie Sanchi of the Hill Times. Tessie, please go ahead.
Great. Thank you so much for taking my question. I will look at labor mobility across provinces for healthcare professionals. Minister Michel, labor mobility for healthcare professionals was a part of your campaign platform back in April. What exactly can the federal government do? There was some confusion, I think, in a Globe and Mail article about legislation, and I just want to clarify. The Liberals said they would tackle labor mobility. What exactly can the federal government do on this issue?
Well, I think first thing I would say is working collaboratively with provinces and territories, because they are the one delivering the services and they are the one hiring the health professionals. So we had those conversations during the health ministers meeting yesterday and today. And we are moving in the right direction, and we discuss about it, and you will know more a little bit later.
Est-ce qu'on peut répéter en français pour Radio-Canada?
Très bien. Alors, ce que je voudrais dire, c'est que, vous savez, c'est la mobilité des professionnels de la santé, je dirais, plus que les médecins seulement. Ça doit aller en collaboration forcée avec les provinces et les territoires. Nous avons eu des conversations très engagées hier et aujourd'hui là-dessus. Je crois que tout le monde autour de la table comprend la nécessité d'aller là, mais nous y allons étape par étape et nous allons continuer les conversations. Mais nous allons dans cette direction.
A follow-up, Tessie?
Okay. I'll stick to the same subject, which is we've been talking about labor mobility for years. Organizations have been, healthcare groups have been talking about this even further beyond COVID. I think the federal government really started focusing on it and post-COVID. Say you'll have more to say about it later. Well, what does that mean? Is there a timeline for this? Because right now it looks like provinces and territories are doing individual initiatives, and it's very piecemeal right now. Is the federal government encouraging a timeline at all?
Sorry, Tessie, I think we missed the first part of your question. Can you repeat it?
It was long. Apologies. Basically, you know, you say you'll have more to talk about this later on the issue of labor mobility for healthcare professionals. Well, how long is this going to take? Because people have been talking about this issue for years.
Okay, so talking about labor mobility, there's 2 aspects of it. We are talking first on labor mobility inside the country, so health professionals moving from a province to another one, and also we have bringing new health professionals into the system, so through immigration process. So on the first part, I would say we need to assess with all my colleagues, and this is what we decide to do, to assess where are the needs and how they can create space for people to move from a province to another one. And I would specifically speak about, people going to north, because there's a lot of challenge to get health professionals to the north. So what can we do collectively? But I, as the federal minister, I have the leadership to convene my partners to work together to move this forward. On bringing health professionals in the country, I would say I committed to work closely with my colleague, the immigration minister, who already knows that we have to streamline the process to bring doctors, nurses, and health professionals in the system more quickly. And about the timeline, I would say we need to see change soon. I would say, first one, I would say maybe 2026.
Merci beaucoup. And our last question online is from Brishti Basu with Press Progress. Brishti, over to you.
Hi, thanks for taking my question. This is for Minister Michel. Minister, you mentioned being in Laval in Quebec to witness the domestic production of the COVID vaccine. Of course, for most people in Quebec, that vaccine is going to cost a lot of money now, as in Alberta as well. Are there any talks of the federal government stepping in to lower this access barrier or remove it?
As you know, our role as Federal Minister of Health is to provide vaccine, in that case, COVID vaccine, but the provinces are the ones delivering the vaccines. So the provinces are doing, they make their choice, and I don't intend to go in their lane in this. What I can say is, if there's a need to have like a collective vaccination on COVID-19, for example, I'm sure all my counterparts will jump with me to provide the vaccine when it's needed.
Thank you. Just a quick follow-up. I guess moving on to a different topic. You talked earlier about leveraging AI, Minister Michel, and passing legislation to improve connectivity. Can you tell us more about this legislation and also like how you think that machine learning and AI actually will help the healthcare system here?
Well, as you know, when we are talking about AI, we are talking about data. And to use AI the more effectively as possible, we need to have this shared data. We need to have the same kind of data across the country. And this is what this bill, the interoperability bill, is bringing, is to release the data so we can use them for AI across the country.
Thank you. I think we don't have any more questions on the line, so that will end the press conference. I want to thank the Government of Alberta and the City of Calgary for hosting us today and the Convention Center, and I wish everyone a good trip back. Thank you.